The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is retired Army Captain Dr. Tommy O'Brien. For 25 years, I devoted my practice and military career to not only medically treating my patients, I have educated and guided them to a healthier lifestyle which improves the quality of their lives. Please contact me by visiting drtommyo.com. That's drtommyo.com. As an osteopathic medical physician, I am able to offer more than one would expect from an MD. I apply hands-on manipulation in concert with medical treatments to not only treat the illness, but the effects as well. Additional services I provide include medical weight loss and medical marijuana. Please contact me by visiting drtommyo.com for an immediate appointment. If you don't have medical insurance, or if your medical deductibles have not been reached or are very high, I offer an easily affordable membership program which allows you unlimited visits for a small monthly premium. Please contact me by visiting drtommyo.com. drtommyo.com, or call 631-980-8200. That's 631-980-8200. And let's put you on the track to a better health and better healthcare at an affordable rate. The Ask Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 Long Island News Radio. I offer a very affordable concierge practice, which allows you access to quality care you really deserve. With no rush office visits, both you and I can discuss your health care needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. The history and physical is a starting point of the patient's story. This is a time when a true physician-patient relationship develops. The patient will explain their past medical history and mention their medications. I will perform a thorough physical exam. This is where I look, listen, and feel. I look at the patient while they're speaking to me. I listen to what they're saying. I feel them both physically and emotionally. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. Call today and schedule a history and physical. If you wait, it's too late. To my military family, I got your 6. To my Masonic brothers, the light is bright. Today's show, I will discuss my favorite topic, and actually one of my favorite ways to practice, and that's osteopathic manipulative medicine. So before I get into osteopathic manipulative medicine, I would like to talk about my journey to becoming the physician, the doctor I am today. In high school, I mentioned several times before, I grew up on Long Island, specifically Freeport. I graduated Freeport High School. While in high school, I was an athlete, but I aspired to be a doctor. I was very familiar with, and I was very comfortable understanding, hands-on, and I aligned well with being, chiropractic medicine. So my mindset was, I'm going to graduate high school and go to college, and I'm going to become a chiropractor. So I enrolled in Nassau Community College, and it's not really a pre-med program. It was pre-chiropractic. You take prerequisites to get into chiropractic college, because chiropractic is not medical school. It's a chiropractic college, and you get your doctorate in chiropractic. So I took all my prerequisites. I was feeling really good, had good grades. This is 1986, and actually it was spring 1986, and that's when I felt that chiropractic, there was limitations, and I wanted something more. There was just inside me a burning desire to want more. And I said, my father was assistant president of Nassau, and I remember going to his office. I remember it was spring 86. I said, Dad, I really want more. I wish I could do, minor surgery and maybe prescribe medications. And he said, Tommy, I'm glad you finally got to that point. So he made a phone call, and he called someone over at New York Tech, and specifically NICOM, which was New York College of Osteopathic Medicine. And he told me, I said, tomorrow I want you to go over and speak to this individual. So I went over to NICOM. I didn't know what NICOM was at the time. And I spoke to this individual, and I knew right away. After I heard what an osteopathic physician was, I said, I know, this is it. Right at that point, I decided to start my journey to becoming the physician I am today, specifically an osteopathic physician. So from this point on, I will refer as an osteopathic physician as a DO. A DO is a doctor of osteopathic medicine. So when you hear DO, think of osteopathic medicine or osteopathic physician. So let's define, what is a DO? A DO is a doctor of osteopathic medicine, which I just said. A DO must have an undergraduate degree followed by 4 years of medical school, specifically osteopathic medical school, and has at least 3 years of residency training. Prior to 1994, you could take complete medical school and then do what we called an internship, which was 1 year after medical school, and then go out and practice. Starting with my year, it was mandatory, minimum 3 years residency. So I enrolled at St. Barnabas' family practice program, and I completed a 3-year family practice residency. I am a DO. I'm an osteopathic physician who specializes in family medicine, as I just said. From this point on, when I refer to a DO, just again, think of osteopathic physician. What is osteopathic medicine? Osteopathic medicine is a patient-focused approach to healthcare that considers every aspect of the patient, including physical, personal, and spiritual well-being. A holistic approach. Understanding that the body is more than just the sum of its parts. DOs assist patients in innate capacity or innate ability to heal by addressing the interrelationship of the body's nerves, muscles, bones, and organs. In particular, DOs are trained to recognize body structure changes that alter function, which may contribute to disease. Previous discussions, I mentioned structure is function. Without proper structure, there is no function, what we call dysfunction. And dysfunction is disease state. What is osteopathic manipulative therapy? This is my passion. I love osteopathic manipulative therapy or osteopathic manipulative medicine, osteopathic manual medicine. This is all the same, just interchangeable terms. We say OMM, OMT. In addition to treating medical conditions with medicine or surgery, DOs are trained in osteopathic manipulative treatment, abbreviated as OMT. From this point on, I'll say OMT. OMT is a therapeutic application of manual techniques by DOs to address the changes in the body structure to improve physiological function. Again, structure is function. If you have structural changes, that becomes dysfunction. Dysfunction leads to disease state. A DO uses various techniques to realign muscle-skeletal system to aid in the healing process. Now, when I was in residency, I had a stamp. It had my name, Thomas D. O'Brien II, MSDO. Below it, it said hands-on healing, and that's what I'm talking about, hands-on healing. In osteopathic medical school, we study 2 years of OMT or osteopathic manipulative therapy. That's 2 years. Your first year, you start learning how to actually the techniques. And in year 2, we advance and we start using it and treating diseases. There's various different techniques. There are as many as 40 techniques now, and basically they're variations of the core. I studied that we had the core 7, and then as time advances, they keep adding new techniques. Many DOs use it in their practice alongside other treatments such as medication, surgery, and lifestyle changes. So to put things into perspective, an osteopath is a complete physician. I can prescribe medications. I can perform surgery. Now, in my case, I'm a family physician, so it's minor surgery. I'm not a surgeon because I did not complete a surgical residency, but I can become a first or second assist, and I do minor surgical procedures in my office, as well as I manipulate. And with coaching, and this is having a discussion with my patients, I am a life coach, so it's a complete comprehensive approach, a holistic approach. This is what I said, that we are the most complete physician there is. So I'm getting ready to get into the the break here. So one thing I'd like to address, the past 3 weeks I've had several individuals call my office for appointments. Majority of my patients do have insurance, okay? They do have insurance. So if you do have insurance, I want you to consider, especially if you're not happy, consider me as your physician. And don't be afraid, because I will give you an invoice that you can submit to your insurance company. Every one of these individuals had things in common. The first was they're not happy with the relationship with their physician. 2, the wait time to get in to see their physician. 3, the amount of time they waited in the waiting room, an hour. And then 4, the office visit was only 5 minutes. 6, the physician wasn't even listening to them. Their back was facing to them as they were typing away in the computer. So come and join my practice. Let's break that circle of dysfunction. Come to me and let me make you feel special, like family. Let me help you lead a happier and healthier life. You wait, it's too late. Don't wait, make a call. Don't walk, run. When my panel closes, I will not be accepting patients. So it's starting to fill now. Make that call today. Welcome back to the Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. Today's topic, osteopathic manipulative medicine. Let's continue. Before we get started, last week and the week before, the prior week, I offered my listeners who own a Kindle reader for a free ebook, my second certified #1 Amazon bestseller, Holistic Healing, True Stories from the Leading Expert in Modern Medicine. Several listeners took advantage of this opportunity and were given a free copy. Again, I would like to extend this opportunity for another 5 more. I only have 5 copies left. So if you have a Kindle reader and you like a free copy of my book, go to my website, click contact. A screen will change. You're going to see a box. Just type your name in, your first name in, and say, I'd like a free copy. And then I will send you a link you can download and follow the instructions, and you will get a free book. A certified Amazon bestseller, Holistic Healing, True Stories from the Leading Expert in Modern Medicine. Again, come and join my practice. Let me help you lead a happier and healthier life. If you wait, it's too late. So I ended off with what manipulation is, or osteopathic manipulative therapy. We call it manipulation. People who are familiar with chiropractic, they will call it adjusting. We call it manipulation. So there are differences between osteopathic and chiropractic. The core values, the core pillars are the same, just that the philosophy slightly changed over years. But the core techniques, or what we call Dr. Still's technique, Dr. Andrew Taylor Still is our founding father. He developed a new concept because he felt there had to be a better way. He served in the Civil War as a Civil War surgeon. And then he was just not happy with the outcome. He lost a couple of his family members, his children, and he said there has to be a better way, and came up with a new philosophy. And it took about 14 years of studying the body and structure's function. Again, structure and dysfunction leads to a disease state, and he came up with a new concept. So who can benefit from OMT, osteopathic manipulative therapy, or osteopathic manipulative medicine? Anyone can benefit from OMT, starting with newborns and ending with seniors. In my practice, I manipulate every single day. What I do is I look at the individual's needs, and I will choose one of the techniques that I feel they will best benefit. What does OMT treat? OMT treats muscle and joints to relieve pain and promotes healing and increased overall mobility. Also, using OMT on muscles, joints, and other tissues allow the body to achieve the state of health more quickly and easily. How so? Well, we call this the artery reigns supreme. That's one of Dr. Still's philosophies or pillars, where we need proper blood flow going to organs and tissues. Oxygen, right? Well, we know blood flow brings oxygen and nutrition and also takes away byproduct, which is the breakdown product of what we call physiological process. Well, if we know if we're working out, we work out a lot, we start to get sore, we have lactic acid build up. Well, we want to make sure we remove that lactic acid, so that will help promote muscle healing. Well, we need to have good blood flow. By moving muscles and bones and realigning, we can increase blood flow to and from organs so we can prevent disease state. Just about anyone at any age with any condition can receive OMT. The beauty of OMT is that I can adjust it to fit the patient's needs, as I just stated. For example, if someone comes in, a young athlete, they injured themselves, which is typical. Maybe they were lifting and they strained themselves. For someone like that, I can use one of the more high velocity techniques. But someone comes in a little bit older, I'm going to use a more gentler technique. I'm not going to thrust on them because, I have to worry about, damaging tissue. The key here is to make my patient feel better. I'm looking for increased range of motion, removing restrictions. How does an osteopathic manipulative therapy, how does it work? How does osteopathic manipulative therapy work? One of the underlying concepts of osteopathic medicine is the idea that restrictions and tightness in your muscles and nerves can cause or lead to other problems. A DO is trained to use their hands to gently move your joints and tissues and form an assessment. The DO then corrects any restrictions in a range of motion. As I stated earlier, OMT includes 40 different techniques, and I will just name a few, and these are the ones that my favorite that I trained with. Soft tissue, we'll know it as soft tissue massage. This is where I will gently stretch and put pressure on muscles and then have them relax and open up. And then we have increased range of motion. The second would be muscle energy. And think of isometrics, equal force. If I have the patient push against me, and then we have equal force, and then the individual will relax, and then I will stretch a little bit more, and then the individual, my patient, will push against me, and I will stretch him more. By doing this, I am lengthening the tightened or the restricted muscle group, and that will increase the range of motion. The next technique is myofascial release. There's indirect and direct techniques. And this is where we're dealing with the fascial planes and the connective tissue that is surrounding the muscles, bones, and organs. Again, using pressure, direct or indirect, I will feel the muscle and I'll look for what we call tender points. And then I will push into it. Again, we have a trigger point release, and I'll use certain techniques to help open up the tissue and increase the flow. What we have a technique is osteopathic cranial manipulation. This is where we're able to move the bones in the skull. It's a very soft technique. I have some techniques. If you have chronic sinus infections, I can work on the face. Then we have my favorite Dr. Still's techniques, and this is known as high velocity, low amplitude, and it's called the Thoracic Thrust, the Kirksville Crunch, because that's where Dr. Still's first school was in Kirksville, Missouri, so the Kirksville Crunch. And this technique produces the cracking noise. It's nothing, that's just a sound that's produced. You're not breaking tissue or bones, it's just an articulation. When you see online on YouTube, you'll see individuals and they're manipulating, or in this case, adjusting, and you hear that, they have a little microphone on, you hear that cracking sound. Well, that's what we call high velocity, low amplitude. You do not want high velocity, high amplitude. That's when you're going to have problems. You start to break tissue. It is high velocity, low amplitude. What does that mean? That means a very quick movement with short distance. You don't want quick movement and a long distance. Then we have problems. You want it short and fast. Can OMT fix everything? No. All right. No, it doesn't. It's not. It just doesn't work that way. There are times when we need medication. There are times that we need surgical intervention, but it is natural. Although OMT is very effective in treating many conditions, like I just said, in some cases they may require additional interventions or treatments, including medicine and surgery. So we got about a minute, a little bit more than a minute left. If you have chronic musculoskeletal conditions and you go to a chiropractor, well, why don't you come to me? I'll take care of you. I'm the complete physician. I can take care of your primary needs because you have a primary care physician, and then you go to a chiropractor. I do it all. One house, one office, and I treat it all. So I'm opening up my doors. I'm still accepting patients. Don't wait. If you wait, it's too late. I have a panel. I have a number. Once I reach that number, I will not be accepting patients, and my panel is starting to fill up. So I want you to give me a call. Let's set up an appointment to schedule a history and physical. Let me help you lead a happier and healthier life. If you wait, it's too late. To learn more about my practice, go to drtomio.com. That's drtomio.com. If you prefer to stop by my office, it's located at 250 Patchogue Yaphank Road, Suite 16, East Patchogue, New York, or give me a call, 631-980-8200. That's 631-8200.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.